iconic What's Happening. Here is today's news. Prime Minister Justin Trudeau not declaring state of emergency over COVID-19 yet in Canada. Non-essential Canada-US travel has been suspended. This pandemic is redefining what qualifies as a political crisis. Alberta has managed to do more COVID-19 tests than any other province. However, an Alberta doctor performed a medical procedure right before he tested positive for the coronavirus. There is one new Ottawa case. A second senator has tested positive for the coronavirus. Trudeau says government will do all it can to help stranded Canadians, but concedes some will remain trapped.
Bonjour tout le monde. I want to begin by recognizing that even though it's Saturday, there are people across the country who are on the job. Whether you're hospital staff or a first responder, a bus driver, truck driver, or freight train operator, I know you're working harder than ever right now. So thank you. You're making a real difference for people who need you. I want you to know that we see that, and we're standing behind you. Whatever our government can do to support you, to keep you safe, to protect our economy, we're doing everything we can to make it happen. And that includes for northern communities. We're working with partners to reduce travel to northern communities to help protect them from the virus. Today, the Northwest Territories will issue an order to limit non-essential travel into the territory. We support this important step. At the same time, we're focused on ensuring essential goods get to people in these communities. We will continue to work with partners and stakeholders on travel to the north. This past week, we also announced new measures to put more money in people's pockets to get through this uncertain time. This means everything from boosting the Canada Child Benefit to increasing the GST credit to giving people a break from paying back their student loans. We've unveiled a plan to mobilize industry to produce things like masks and ventilators. And to accelerate vital research, $25 million will go to teams across the country working on measures to detect, manage, and reduce the spread of COVID-19. For Canadians who are overseas, we're sending them texts with important information. We've announced new funding to help people borrow up to $5,000 to return to Canada or to cover their needs while waiting to come home. And public servants are working around the clock to help people who are stranded. On that last front, we've continued to make progress in the last few days.
Coronavirus is redefining what qualifies as a political crisis. It may be hard to believe now, but it was only a few weeks ago that some commentators were arguing over whether Canada was broken. Their concern at the time was a series of rail blockades triggered by Indigenous peoples' objections to a resource project in British Columbia. Lost in the tumult of everything that has happened since was a report by the Parliamentary Budget Officer that estimated that the total economic impact of the blockades was likely to be a decline of 0.01% in Canada's nominal GDP for 2020. A blip, in the words of the PBO. We're in another world now. One estimate released this week projects that Canada's nominal GDP for the year will decline by 5.1% as the result of the novel coronavirus, including a double-digit decline in the second quarter.
We've been talking about when we can expect this peak. What does the peak look like in terms of how many hospitalizations there might be?
Again, it's a difficult question to answer, and again, kind of goes back to that total number of deaths question. That depends on us. The total number of hospitalizations, the total number of deaths, the total number of cases, that depends on us, all Albertans working together to limit the spread of this virus, doing all of the things that I've been talking about, that many are talking about with social distancing, following the guidance and the orders that were issued. So the total number of hospitalizations and deaths, it's up to us to keep that low.